Okay. I'm Mariam Al-Arbid. I'm a nursing director with Chest Hospital in Kuwait. Today, our quality improvement plan is about improving nursing documentation using focused PDCA methodology. Our focus during our audit of the last few months, we found out that according to the last audit, the documentation scored 70% only from required checklist we have for the past 3 months. So we decided to increase our accuracy of nursing documentation to 100%. So number one, we organized team consists of nursing director, assistant director of nursing, a staff developmental unit member, which is CI, head nurse of ICU, and a team leader of CCU department. Our process flow chart was the nurse receives written handover for all patients or for her assigned patient, then documents subjective and objective data, which includes what the patient said, what the nurse assisted during her process of care, physical findings of that patient, behavioral and health findings, any data relevant to that patient regarding abnormal lab values, abnormal radiology imaging, or any test results, and the response to intervention, like the medication and all treatments given for that patient. Then regarding nursing diagnosis, the documentation, we are using clinical nursing judgment based on the assessment data and using NANDA nursing guide diagnosis as a guideline. Our outcome or identification and planning will be through documentation by individualized outcomes and measurable outcomes, and my plan for nursing care for the next time of my shift and realistic time frame. Like I will write in the nursing notes my plan during my shift and my actions and interventions during that shift only. I will not exceed this. Our implementation, the implementation process will be the documentation, what I did as a result of my assessment and findings, actual nursing care given to that patient, the patient's response to my intervention, and anyone I contacted and informed regarding that patient, plus my evaluation, my assessment for reassessment of the patient status after I implemented my plan, and achievement of stated outcomes. Like the patient potassium was low, we gave him potassium replacement, we repeated the potassium level, and what's the result now after our after our intervention. And nurse gives written handover to the next shift, and so on. This is our flow chart of the nursing process of documentation. Now, I use the fishbone analysis. We have different issues related to the patient, the identification, sorry. So our identification will be related to machines, poor nursing documentation. It will be because of machines, methods, and manpower, plus materials and environment. Our machines, we don't have HIS system or computerized system. Our assessment and monitoring machine lack memory storage. Regarding methods, no policy on like no accurate unified policy. We have only international policy regarding the documentation, lack of knowledge, and less training for the new staff, and repeat recording the same to save time, and same information repetitive, plus unnecessary documentation of data, or less auditing for the nurses' notes or nursing documentation. Now, regarding manpower, because of it's related to manpower, or we call it in another name, human error. It's because poor handwriting, staff exhaustion and burnout. Like we have some units supposed to be run by 70 staff, but the actual number is 30. So it's more burden on that staff. No provision for typing notes, because no HIS, no dictators, so nurses has to write everything by themselves. In staff exhaustion and burnout related to increased workload and poor assignment and shortage of staff, all of it related to the manpower or a human factor. Now, materials, we have sometimes shortage of ministry official papers, so we have to do copies, and that copy sometimes it will be unclear because of the photocopies, and plus some units has shortage of printed recordable papers in the unit. Related to the environment, damaged bedside tables, no provision to sit and write, everything has to be done while standing, and the physical setup of some units are not user-friendly for writing documents, and crowded wards with interruption from doctors, patients, patients, companions, and by patients themselves. So it will multiple interruptions of nurses' notes. It will, يعني, مثل you lost your train of thoughts while writing because of the interruptions. Now, we selected the improvement by using prioritization matrix. We have create documentation policy, train the staff, frequent auditing, and improve assignment distribution, make documentation forms available, and find and alleviate the interruptions, limit visitors and repair bedside tables by and increase the machines, and we have more comfortable stations for the nurses to write, make more chairs available for nurses to use while doing their documentation, make HIS available and speech dictators for typing, increase number of staff as per nurse to patient ratio. We have the achievable is limit visitors. We chose to limit visitors, repair bedside tables, increase the machines, plus more comfortable stations, and make more chairs for nurses to make them write their notes. And the effective priority we have, create documentation policy, do more training, frequent audit to find where is the deficiency, improve the assignment distribution, make documentation forms more available, and in the future try to push for HIS system and speech dictators for typing, and increase number of staff. Now, regarding our plan for the change, we use Gantt chart by the actions we're gonna work on and people responsible for create documentation. Create documentations. It's the documentation policy. Usually I'm the one who's responsible. Nursing director, she's the one responsible for writing a documentation policy, and we're gonna do it within the first 2 weeks of January. Train the staff, and perform audit for the staff implementation of that policy. It will be done by staff developmental unit from the 1st of January till for the whole January, and continuous audit for the rest of the year. Ensure improve assignment distribution by teaching the head nurses and nursing supervisors about the fairness of assignment distribution, and we're gonna do it within the first month of the year. And ensure documentation for forms are available, and check for repetitive unnecessary data by doing our audit, and it's usually done by staff developmental unit. And we're gonna discuss the administrative level and public relation about the limiting the visitors with follow strict visitation protocol in the rush hours of the care, and try to contact engineering department to repair the bedside writing tables and reprogram machines to be user friendly and for more clear photocopies. And try to discuss with the administration and convince them about the importance of having HIS system and speech recognition machines, and modify the workstation to be arranged to accommodate more staff to sit and write in a comfortable position. And try to do in the future with the nursing directorate administration about the possibility of increased nurse to patient ratio in the hospital. Now, we're gonna do the change by action according to the plan and check the results by doing this checklist. And we chose as a pilot, we're gonna do it in our cardiology wards only and CCU. This is our cardiology department, which is ward 1, 2, 3, 4, CCU and cath lab. This is the checklist we're gonna do the audit on by identification of data presented, legible and logical and sequential events, dated and signed according to the policy. And these are the recommendations based on the International Council of Nursing to do the audit for nursing notes and nursing documentation, and evaluate them accordingly. Now, act by corrective action and hold the gains. And based on our data, we're gonna discuss it with the future in charge for the supervisory levels based on our audit and follow up after the implementation. Thank you.
شكرا لحضرتك جدا. حقيقي البروجكت حلو قوي قوي، من اول ما شفته هو عاجبني، لان هو خد جزء مش كتير مننا بيحاول يعمل امبروفمنت بروجكت عليه، فهو فكره يونيك. انا بشكر حضرتك عليها. انا ما عنديش اي سؤال، لو حد من الزملاء عنده سؤال يتفضل. في اي سؤال تحبوا تسالوه، تحبوا تتناقشوا فيه، في حاجه مش واضحه؟ تمام، انا بشكر حضرتك جدا جدا. شكرا ليكي، مجهود ممتاز.
شكرا
دكتور. بس هنستوب الشير. الناس بيشجعوكي، بيقولوا لك بصراحة رائع.
Thank you.
برافو.